Introduce yourself.
I am Dina Vadis. I am a diploma nurse with 7-year experience. I am excited to work in USA.
Where did you get your nursing education?
I did my nursing education in Devamada Hospital and I completed the course in the year 1998.
How many years have you been practicing as a nurse and in what areas of nursing?
I have been working as a nurse for the last 7 years. I have 2 years experience in the surgical ICU and the remaining 5 years I worked in medical surgery ward.
Can you describe the types of hospitals you have worked in?
I worked in 3 hospitals. After my course, I worked 2 years in the same hospital where I studied. It is a multi-speciality hospital with super specialty in gastroenterology. It is a 250-bedded hospital. Thereafter, I worked in Sharma Hospital, New Delhi. It is a general hospital with 100 beds. Last, I worked in Chitra Hospital, Kottayam. It is a general hospital with a bed capacity of 300.
Why did you choose nursing as your profession?
I chose nursing as a profession because of various reasons. I think it is the most suitable profession to help other people, and I also think it is the most sacred profession in the world. Also, it is a job-oriented profession and we get many good opportunities anywhere in the world.
What are the most challenging aspects of nursing?
Nursing is the most challenging job and many aspects of nursing are very challenging. In this profession we are handling the lives of people, so we need to careful in each and every moment to save the life of people, and we have to do extra work and night duties even though we are tired. We should be patient always in busy times.
What is most rewarding to you as a nurse? Provide us with specific examples.
The most rewarding thing in this profession is the job satisfaction I get from this profession. I can say one example for this. Once I was working in surgical ward, I had a call from one room. I rushed there and I noticed one patient is on cardiac arrest. Suddenly I called for help and gave cardiac massage. By the time the doctors arrived and shifted him to the ICU, thus we saved the life of that patient. After that, other staff and the relatives of that patients appreciated me and they were very grateful to me. So this is the one incident.
Describe how you work with doctors in various circumstances.
I work with the doctors as a team and I make a friendly co-worker relationship with them. I respect them and obey their orders honestly. I ask doubts and clear my doubts, and I assist them in each and every procedure.
Describe your work ethics using specific examples.
There are many work ethics a nurse should follow. A nurse should show love for the fellow man, and he should be always obedient, loyal, dependable, understanding and alert. Moreover, he should be honest and patient.
Describe a patient care case from your experience in hospital work that you were in part of and that it made you feel like you performed above and beyond the call of duty.
One day I was working in medical ward. One patient became very serious. He went into shock and I found nobody is to care that patient. So after my duty shift, I stayed with that patient and I gave complete care to him. I gave IV infusion and blood transfusion to him, and I stayed with him till he became stable. I went only after he became stable.
Would you like to close with any comments to your future employer?
Yes, if I get a chance to work with you, I will be do my level best. I will work with you very efficiently and honestly.
It was really nice talking to you, Miss Binna Verghese.
Thank you, madam.